This video describes our initial experience with the Zepto Precision Pulse Capsulotomy device that's designed to create a consistent 5.5 circular capsulotomy. Here we're using a 2.2mm incision. We're just going to examine the device first. This is the top of the device here. We'll just turn around and look and see the circular nitinol ring, the push rod present there, and the soft silicone skirt. Prior to insertion, we're going to push the push rod all the way forward here to engage the nitinol ring, ovalizing it here. You can see it's flexible, and this creates a collapsible silicone sleeve and nitinol ring. This will allow us to place the device through that 2.2mm incision. So just to make sure the push rod is engaged properly, there's no abnormalities and no debris present. Just checking that prior to insertion into the eye. We'll slide the device into the anterior chamber through that 2.2mm incision fairly easily using a pair of forceps. And now we will then pull the push rod back using the slider on top of the device. The push rod remains, however, in the shaft just past the silicone skirt. This will allow us to have good control of the device. Heel up and tip down a bit to ensure we have good applanation of the anterior capsule. Here we're going to center the device, the silicone skirt, on the first Purkinje image, as you see right there. Once we have it centered well, we will ask our assistant to turn the suction on, and the push rod is retracted right away, as you see, within a few seconds. And we see bubbles starting to now emerge and be suctioned into the shaft. Once we reach maximum suction, you can see the bubbles basically essentially stop flowing. At this point in time, we will then ask the energy to be applied. There you see it, and this will create the cut. And within 1 or 2 seconds later, we will then ask the assistant to release the suction, and now we have the creation of the capsulotomy. The device is then pulled out, it collapses nicely here through the main incision, and now we can see the nice circular device well centered here. Phaco goes quite uneventfully, having a nice strong capsulotomy, as well as cortical removal, fairly routine as per routine cases. In this case, we are now injecting some viscoelastic, typically cohesive here, and the intraocular lens is folded in place through that 2.2mm incision. Of course, the beauty of this device is consistent capsulotomies, 5.2mm in size, to create an excellent overlap of the IOL with excellent strength. And of course, this is one of the most critical aspects of safety of phaco, as well as effective lens position and the precision of the refractive result.